Hi, my name is Dr. Carl Wierks. I'm a partner at West Michigan Orthopaedics, and I'm here today to talk about hip arthritis. Hip arthritis can really be divided into two main categories. One is osteoarthritis, and the other is inflammatory arthritis. One key takeaway is that hip arthritis is very treatable without compromising quality of life or activities that you enjoy. Osteoarthritis is far more common. The hallmark feature of osteoarthritis is the cartilage breakdown on the weight-bearing portion of the joint. So when we're born, that hip socket covering, which is a ball on a socket type joint, is smoother than glass. So it provides, excellent smooth rotation of that hip joint. But in the setting of osteoarthritis, that cartilage that's smoother than glass starts to initially thin down, and then it'll flake off. You have chunks that can break off in the joint and have loose bodies, and then it kicks off this secondary inflammatory cascade, which generates a lot of pain in the hip joint. And so the symptoms of arthritis are hip pain, and not everyone knows that hip pain typically presents in the groin. Alternatively, you can also get pain like in the side or the back of your hip. You can get some pain going down the front of your thigh to the level of your knee, but it's very uncommon for a hip problem such as arthritis to give you pain shooting down below the level of your knee. Hip arthritis, the way it tends to present is growing pain like we mentioned, also limited range of motion, and so stiffness of the hip joint, trouble doing things like stairs or putting on socks and shoes. The underlying cause of osteoarthritis can be traumatic, but mostly it's just gradual over time with wear and tear. What we are discovering is that a lot of these causes that don't have a specific trauma to them probably have some underlying shape mismatch in the hip joint between the ball and the socket. And we refer to that as hip impingement, or FAI. And I have a similar video really focused on FAI that you can reference for that. But we think that shape mismatch between the ball and the socket causes trauma to that weight-bearing cartilage, which really stimulates that process of cartilage breakdown. And once arthritis sets in the joint, the natural history is just gradual progression over time. And that progression tends to be stepwise, where you have some level of symptoms for a while, and then all of a sudden that'll change and your symptoms will increase and you'll be at that level of symptoms for a while. Non-surgical treatments include trying to avoid painful activities, and these tend to be deeper hip flexion positions. So if you're trying to work out and avoiding things like squatting or lunging, but eventually people start having pain with that normal daily activities, including stairs or even just sitting. They have trouble putting on socks and shoes. Other treatments, including the activity modification, are ibuprofen type medications, which are NSAIDs. You can also take Tylenol in addition to that. And in some cases, we do cortisone injections in the hip joint for temporary treatment measures. So if those conservative treatments that we just discussed fail, then really the best treatment is a total hip replacement, which really is probably the best surgery we have in our field to get patients back to pain-free or nearly pain-free, both activities of daily living as well as recreational activities. So I don't typically impose precautions on my patients who have a total hip replacement, other than I really do discourage them from running recreationally. But I have several patients who enjoy doing things like skiing, working out, yoga. So you can really go back to pretty much a normal life after having a total hip replacement. The total hip replacement has really become minimally invasive enough, and we have really advanced our ways of trying to control pain, that if you're healthy and motivated, then you can go home the same day as surgery.